Hi, my name is Cecily Meyer, and I'm presenting on nurse residency programs today. According to the ANA, the United States will need about 1.1 million new nurses by 2022, which is quickly approaching. They recommend implementing nurse residency programs, and basically a nurse residency program is a more in-depth, extended orientation than what a regular orientation would be for most places, say like 6 weeks or so of like hospital and unit-specific orientation. Nurse residency programs focus more on the transition of the graduate nurse into the professional role while under the supervision of experienced nurses. There are several different factors that can lead to the nursing shortage, such as job dissatisfaction, fatigue, and injury, which leads to high turnover, increased mistakes, and medical errors. The new graduate nurse turnover rate in the U.S., so a new graduate nurse would be somebody with a year or less experience at working as a nurse. Their turnover is about 40 to 60% in their first year. The cost of a new nurse in their first year is $22,000 to $77,000, so that includes their salary plus their preceptor's salary plus any other training that they may receive during that time. And 50% of new graduate nurses are deemed competent during their first year, so that means the other 50% are deemed incompetent. So the problem here is that there's a lack of confidence and competence, poor patient outcomes, decreased morale, and high turnover rates that are affecting more than just the brand new nurses. The IOM recommends implementing nurse residency programs to help improve retention, competency, and patient outcomes. A research study I looked at was done at the University of Texas in the Del Sol Medical Center, where they implemented a nurse residency program during their nursing students' like senior year, where it was like a 10-week program that they got training at the Del Sol Medical Center. They had a savings of $600,000 in that 10 weeks, plus every single one of those students took a position there, so all their training was pretty well done by the time they started working as a nurse, and they had satisfied, competent nurses as well. In this research study too, it also mentioned a hospital in Wisconsin that implemented a similar nurse residency program, and they had 100% nurse retention for 2 years straight. Some of the literature review that I did, in the southern United States, there was 13 mid-sized healthcare organizations that averaged 200 to 500 beds. They had 109 RNs that had 1 year of experience or less in their nurse residency program, which was 10 months long. Some of the outcomes that they were going for was improved retention rates, leadership development, improved skills in competency in planning, evaluation, and patient care. They also kind of looked more at a shared vision, challenges that these nurses might face, or challenges that they are facing, enabling other, and encouragement among staff. They had 28-hour sessions that focused on a different competency each time that they met, and some of their results were they had an increased retention rate of 15%, or by 15%. And some of the recommendations that they had for after this program was that they need to set clear goals, expectations, and content that supports leadership development. Another study was in the Midwestern USA that focused on 10 urban hospitals and 15 rural hospitals. 468 nurses were involved in this, with 86 from the rural hospital and 382 from the urban hospital. It was a 12-month program. Some of their outcomes that they were looking for was clinical skill competence, social support network, further training, and guidance from experienced nurses. They had several different tools that they used, such as a clinical decision-making scale, a nurse job satisfaction scale, job stress scale, and an organizational commitment questionnaire, basically to measure all those things as well. Some of their results is that they had a job satisfaction increase of 7% and a job stress decrease by 7%, and they recommended building new nurse competency to help deliver patient-specific care. In Singapore, they did a study as well with their BSN students in their final year. There was 94 students involved. They did simulations They had a 3-hour course over 5 weeks for 15 hours total, doing realistic clinical settings scenarios. They were looking to improve prioritization, teamwork, time management, delegation, and emergency situations. Some of the themes that they found after doing a discussion after each one of these simulations is students liked experiencing the role, knowing what to expect, complex roles, knowing how to do things, the holistic care of the patient, managing difficult clients, communication, decision making, and learning from others in organization. Their recommendations were to help improve clinical skills, teamwork, work organization, decision making, and prioritization. In Australia, they looked at a 334-bed hospital. It was a 12-month program that focused on the LPN to RN transition. Some of their outcomes that they were looking for is to improve clinical and social support, as well as team building exercises. They had 3 one-hour focus groups. It was open-ended questions to promote discussion, and some of the topics that they focused on was stepping out of the comfort zone, feeling of being taken advantage of, and needing as much support as others. Their recommendation from this study was that the transitioning LPNs still need as much guidance as a new graduate RN, and they should be treated more like a brand new nurse, as if they're coming straight out and have no knowledge at all. In Southwest Florida, there was 4 acute care hospitals and 2 specialty hospitals for a total of 1,423 beds. They had 248 new graduate nurses in their program, which was 5 phases, focusing on assessments, critical thinking, individual competency, and clinical coaches. They focus more on assessing and validating the nurse's competence, and they had positive assessment results increased by 62% and organization savings of over $91,000. Recommendations included clinical coaches, individual development, and interactive patient-centered learning. So my PICO was focusing on, does a nurse residency program for new graduate nurses improve retention rates compared to a traditional orientation program? The theoretical framework they used was from Roy. It's more about a holistic perspective of the patient and helping them to adapt during different situations. New nurses need to be able to adapt to these changing situations, and the preceptors and mentors also need to be adaptive while they're training these new nurses. So I would like to do a study at a Southern Indiana healthcare organization that has 143 beds and 33 healthcare centers. It would be quantitative, quasi-experimental. I would gather turnover rates from the last 3 years and use Casey Fink surveys, give surveys at the beginning, 3 months, 6 month, 9 months, and 12-month mark. Assess strengths and weaknesses in various areas related to nursing and the organization as a whole. It would be a year-long program. I would like to have a minimum of 10 new graduate nurses, or those with less than 1 year of experience. The hiring process would be an agreement to participate in the program, and there would be another survey after 1 year of completion of the program. The Casey Fink surveys focus on the graduate nurse experience, nurse retention, and readiness for practice. In conclusion, the nursing shortage and the high turnover leads to an increased critical situation. One of the solutions to help solve this is improve graduate nurse transitions into the professional role with nurse residency programs, and nurse residency programs are proven to decrease turnover, improve competency, competence, communication, and teamwork, as well as saving organizations money and improving patient outcomes. And the rest is just my references.